Well, welcome back to Virginia this morning, live here on CBS 6. In observance of National Mental Health Month, we wanted to talk about how you can take control if you or a loved one needs help or resources. Here's Jessica's recent conversation with an expert in the field.
May is National Mental Health Awareness Month, and what better time to be joined by an expert than Dr. Keisha Hite. She joins us this morning for this very important conversation as we turn the focus during this month of May on mental health awareness. Dr. Hite, it's wonderful to see you.
Thank you, Jessica. Thanks for having me.
It's absolutely my pleasure. This is such an important conversation to have every point during the year. But of course, as we shine the focus during May, it's a great time to get this conversation started. There's probably not many people across our world that have not been impacted in this last year in some way, shape, or form in terms of impacts on mental health. Is that what you're seeing?
Yes. Listen, Jess, this year has been very, very heavy, very traumatic with COVID-19. The whole world has had to deal with COVID-19. It hasn't been just a one person issue. It's been a whole entire world issue. And the whole entire world has experienced some sense of loss, whether it's loss of employment, loss of loved ones, loss of freedom, loss of financial job stability, and we're all impacted by that.
We really are. And I'm really glad that you brought that up, because maybe typically people would have thought of loss or considered loss in the way of maybe losing a loved one, a friend, somebody that you know, but there are different types of loss.
That is correct. And, unfortunately, I had battled with COVID-19 myself in December. Fortunately, I was able to bounce back from it. But my mom here recently, she was diagnosed with COVID-19 and she was placed on a ventilator. And the doctors was giving me some very tough decisions to make at that time. And myself as a therapist, I was struggling with making those decisions and trying to cope. And, it's okay to reach out. It's okay to reach out for help. And even myself as a therapist, I had to do that.
Dr. Hite, do you find, we use the term PTSD to describe traumatic situations. Are we looking certainly at this past year as being particularly traumatic and maybe tethering itself in PTSD for people?
Most definitely. The thing about PTSD, and one of the symptoms of PTSD is trauma. And you can also have vicarious trauma. And what we see is people who were directly affected with COVID could have PTSD, and the family members also could have PTSD with that vicarious trauma. And us people as a whole, we have to learn how to cope and deal with that, because that in turn can turn into depression. And people start using alternatives like substances to cope with that depression, to cope with that isolation, and to try to make themselves feel good.
Do you find that individuals are maybe surprised at how quickly those things transpire? You mentioned having a situation where you experience the trauma that impacts you. You may develop or exacerbate anxiety and depression, and then you start depending on certain substances. Does that happen faster than people really are aware?
It does, typically, because they do not realize that they are doing it. At the moment, it's an instant response to a coping mechanism, with subduing the feelings that I'm feeling at the moment. So I turn to substances to try to subdue those feelings that I don't want. And then it becomes habitual. And as it becomes habitual, it becomes a habit. And people do not realize they're developing a tolerance for whatever substance of their choice that they did at that time.
So, Dr. Hite, in that respect, you mentioned as the individual who's experiencing the impact on mental health, what are some of the signs that maybe we can recognize, or if you have loved ones surrounding you, friends or family, that they should be looking out for?
Well, personally, if you have this intense fear, if you're having difficulty sleeping at night, if you're having ruminating thoughts, meaning thinking about what's going to happen to me, having fears of going outside, having fears of if I could contract COVID, if I touch somebody, if I'm around somebody, all of that, family members can start looking at people who generally isolate themselves, don't want to come out, don't socialize, inability to eat. And then the physiological effects, sweating, stomach hurting, nauseated. Those are some key factors that you want to look at if you feel like you're developing some sense of anxiety and potentially depressive disorders.
And Dr. Hite, at that point, if any or certainly all of those signs and symptoms are being experienced, it's time to turn to a professional, to start exploring a mental health professional if you're not already working with one.
That is correct. It's a lot of mental health professionals out there that you can seek. You can Google, you can go on Psychology Today, you can search for different therapists in your area. The other thing is that if you want to seek medical, you can go to your primary care physician and ask for a referral. Primary care physicians, they are connected to therapists that can assist them with trying to find somebody to help them cope with those problems and those issues.
And Dr. Hite, one last question. We're just about out of time, but let's say in certain situations, you may already be experiencing anxiety, experiencing depression. You may already be in treatment for those. In this time that we've just experienced, and as we focus in this month of May on mental health awareness, what if you have shifted as an individual to that next level? And perhaps if you are taking medications, you're finding they're not working anymore. Is this something that maybe those signs your loved ones would point out and you talk with a professional?
Most definitely. The thing is prevention. The thing is trying to catch it as soon as it starts. Because the deeper you get into it, it can be hard to come back from. And if you're already on medication, that's a level of deepness. So that's the biggest thing, is recognizing it and getting help as soon as possible.
Taking time to focus on it any time of year, but certainly during this month of May with mental health awareness is important. Dr. Keisha Hite, thank you so much for carving out time today to talk with us.
Thank you for having me.
Our pleasure. We'll share some information so folks can learn more.
Thank you.